Welcome back, friends. You know, New Orleans East Hospital offers key services to residents of the East, from comprehensive care to emergency medicine. And today, we are shining a light on all the work that they do for the community they serve. Joining now is A Vision in Purple. It's the CEO and President, Dr. Takesha Davis is in the house. Good to see you, sister.
So good to see you, Malik, and thank you so much for always having us back to talk about these services.
Because, you know, I love what you all do at New Orleans East Hospital. Now, something I did not know when I was preparing for this interview, that this hospital really was formed after Hurricane Katrina. We just celebrated the 20th anniversary. Tell me that story.
Absolutely. So after Hurricane Katrina devastated the city of New Orleans, it left New Orleans East without a hospital for 9 years.
Wow.
So the New Orleans East Hospital was birthed after Hurricane Katrina, building on the legacy of the Pendleton Memorial Methodist Hospital, but a little bit different, because now, instead of being a private hospital, the New Orleans East Hospital is the city's only owned hospital. The city of New Orleans, as it was rebuilding, understood that it needed to bring back quality health care to New Orleans East. And so it bought the hospital, but it also knew, hey, we don't know how to run hospitals, so we need to partner with a quality partner, which was LCMC Health.
Yes.
So we are a part of the LCMC Health family, but we, as New Orleans East Hospital, and the city's only owned hospital, are open to every resident of the city of New Orleans. And even more interesting and important for your viewers to know is that we take care of anyone who walks through our doors, irrespective of your ability to pay.
I love
so
that.
We don't want people to not get the right care right where they need it because they feel like their pocketbook can't afford it.
And I'm so glad you all said that, because Lord knows the price of health care is expensive these days, and I love that you all help out people regardless of their ability to pay. And I know one of you all's cornerstones is your emergency department. So if I'm injured, I can come there.
That's right. So, you know, we pride ourselves on providing well care, not just sick care. But if you are sick and you are injured, our emergency department is vital to making sure that our community stays healthy during those times when we have those unfortunate accidents, everything from a fall to maybe an accident in your car.
Right.
The emergency department is there, and it really has helped to provide stability of care in our community, create that trust relationship that we are always there when you need us.
And you offer so many different things, which I think is great. Of course, you all have an expanded GI services, maternal fetal medicine, and outpatient rehab, but you also got some new things if you haven't been to the hospital in a while.
We do.
Wound care center?
Yes, so listen, as we get older, there are times when we have to take care of these issues where we have wounds, particularly for our seniors who may not be able to move around as much. And so they develop bed wounds. We have a wound care center to help to take care of those things. But also, we are opening our infusion center. That is a place where if you need to get IV medications, you need to get blood transfusions, you no longer have to go and sit long waits in the emergency department or go outside of the community. You can come right to New Orleans East Hospital, and we're really excited about the work we're doing to bring back behavioral health services to our community. So those are services for those who have mental health needs, depression, anxiety, other diseases and disorders that require behavioral health specialists that, let's be honest, our community is not getting the care that it needs. And we used to have a lot of care in New Orleans East before Hurricane Katrina for those issues.
And I say this all the time, mental health is just as important as physical health. So it's so great that you all are offering that.
It might be even more important, right?
Girl, in today's times, absolutely.
Exactly. Without a sound mind, a sound body don't mean nothing.
You better come on.
So it's important for us to recognize that. And I know sometimes people are fearful about talking about their needs for mental health. So we want to make sure that we provide that same quality, compassionate care for our mental health patient needs that we do for our physical health needs.
And do we know when that's going to open?
We are working on that feverishly, starting on the construction, because we don't do anything partially at New Orleans East. We want to make sure that it is top notch and it is the best care that we can provide to our community. So we're hopeful for early next year, but we'll keep you posted.
Come on, we'll just come back on and let's talk about it, because you're always welcome.
Yes.
And what I think is great, I love how you said you all don't just focus on sick care, but well care as well. You all are out in the community, you do health screenings and all that jazz.
That's right. Our community deserves to be well, right? It's important for us to be in New Orleans East to take care of us when we are sick and we we have those emergencies. But frankly, there are too many times that we suffer from preventative health diseases like heart disease and diabetes, that if our community had access to the education, the screenings, the outreach that we provide at New Orleans East, we can prevent that. So we are in partnership with our community. It's transformational for them to get the education that they need and be able to not be sick, get off of the insulin, get off of your medications, because now I have access to healthy food education, to our farmers market that we have reinvigorated in New Orleans East, to screenings. In that way, we can continue to make sure that we are here for decades to come.
Come on, Dr. Davis. Look, I love you so much, my sister.
Yes.
Congratulations on everything.
Thank you so much.
And remember, you do not have to be a resident of New Orleans East to use the services. 5620 Reed Boulevard is their address. NOEhospital.org for more information. We'll be right back.